Dr. Caryn first. Thank you very much. To Dr. Caryn first. Let's be practical and pragmatic at the same time. Researchers or even senior academicians, you will have access to all the relevant documents for you to identify the gaps. What would you suggest for students, which I think there would be some here, especially students and young junior researchers, on the process of identification of those gaps that they need to develop their own research? That's the first question. Let me give you another one. In regards to the issue that you brought up at the very beginning of your lecture, how would we better communicate the research outcomes to the relevant people who really needs it, not just simply stakeholders or the other when we publish it as manuscripts, but really to those who really matter? That's the second question.
Thank you, Dr. Zabri. Hello. Thank you, Dr. Zabri, for the questions. I think these are very, very interesting questions and relevant. So for students, you may not inherently know what's currently a priority, right? What funders are looking at. And so there are many ways you can go about this. The first resource, the most important one of all, will be speaking to your supervisor. Approach your lecturer. Most of us we have ideas, but the thing is we are time poor. We don't really have the time to go out on the ground and to propose research, and that's where you come in. So speaking to people, experts, you can approach them, use them as sounding boards to get ideas as to what's needed. Because sometimes at the very early, when you start to initiate a research career, you may not have a very good idea as to what is. I've had students, undergraduate students coming in with ideas, brilliant ideas for projects, but they're looking at 3-year programs, 5-year programs. They want to cover 10, 15 different objectives. So this is where your supervisor can come in and let you know that, look, you are working on a time crunch, you have about a year at most. Okay, for undergraduate students, probably only 3 to 4 months. For masters, less than a year. For PhD, just a maximum of a year that, in terms of time, if there's a data collection that you have to run the study, to do it within the thing, that they are able to tell you your best resource in terms of what is feasible, what is doable, and what you can achieve. Alright? And other than researchers, professors in academic settings, you can also look to patients. If you're already working in a clinic, you're already working with patients, these are things that they will tell you what's needed. They will tell you what will make. I think that this is a point that Dr. Mark raised just now. Alright? We assume the issue with research right now is that a lot of the times we experts tend to dictate or to determine. We tend to want to do for people what we think is most important for them, what would serve them. When in reality, it's actually the patients who will be able to tell you, look, you can come up with more programs for us. By the end of the day, sometimes you feel like you're just using us as guinea pigs. Alright? Is this a vehicle for something else? Is there some hidden agenda? And at the end of the day, you can come up with services for palliative care, for psychology, but nobody's going to use them. So listen to them. The patients are the best resource. The people on the ground, they know what's needed and what is not. We can have the best of intentions going in, coming up with funding, secure funding from overseas, to run all these beautiful, well-intentioned programs for people, but at the end they tell you like, yeah, good for you. And then you wonder why they don't work after a few years. So all this needs to be taken into account when you're planning something, planning your research. Not when you already run it, when you already done something, at the end of it, when you start evaluating things and seeing like what can work, then you realize that otherwise it'll just be a waste of resources. And the second question, how do we communicate the findings to people that matter? So this is where I believe that, at the early stages of a career, you just do what you know how to do and you try to do it best. You have some findings, and when you have something that you think might be interesting, even though sometimes for myself I'm an introvert, so it's a bit difficult to want to speak up at things. By the end of the day, if you don't train yourself to speak up, and this is where you need to attend conferences, you need to attend events, and you need to make yourself heard. Because you have to think more than for yourself, you have to think of the patients you represent. If you don't represent your students, your patients, then no one's going to realize that, this is good work that's been done. This is how otherwise you're not going to get the work taken up. Alright? That is how you can forge the connections at events like this. And that's why I think all you here deserve a round of applause for being here, you know, for taking that step to learn, especially on sacrificing your weekends like this. So I hope that addresses your question.
The point is just to convey to especially the junior researchers. I mean, you, me, the rest, you know, the seniors, we know what to do. But the lead is, the need is for them to understand that.
Maybe if I just add one more point with regards to identifying research gaps, because having a few PhD students, we always know that's a formidable challenge. And what comes to mind immediately is that you've got to spend like weeks living in the library, digging up journals. It's also useful to sometimes consider that a place where you can also find research gaps is when you know something for a fact, and it's something which everyone in your field knows it's true. But then when you speak to a patient or someone on the ground and they say, actually no, that's not what happens to me. When there is a contradiction between what you know in your field as a fact versus what someone's real life experience is like, you have a gap there. And then if you want to, it's useful to then go down that rabbit hole, find out, well, why is there a contradiction between what we know, what we experts all know as a fact, and what someone who is on the ground, who is actually living through that, is saying something differently? Why is there a reason? Maybe there is an established theory that explains that difference, but commonly as well, it turns out that actually there isn't. It's something that we've taken for granted, and that there is actually a gap that requires explanation. So putting your ear to the ground and listening to voices for contradictions to what we think is established fact is also a useful place to look for research gaps as well.
Okay, thank you. So I think this is it's an important advice given by Prof. Chan and also Dr. Mark, because most of you are students, as well as some of you are even earlier career researchers. So how do you develop research questions? What are the gaps, and how do you going to address them? I think we have a good example here, which is who is doing the PhD, and how she went through the processes in order to come up with the research questions or hypotheses or the research gaps, and eventually led her to do a PhD. I think she has given some excerpt of her PhD work, so you can see how maybe you want to share some experience with that.
Yeah, I agree with what Prof. Caryn and also Dr. Mark said. The important thing is to speak to your supervisor, because whether the research is feasible within that period of time is very important. As we develop the research question and get the gap, like Dr. Mark said, we know that this thing exists, but whether it is feasible or not to be done within that short period of time, and then where to gather the data, and also look into a more niche, tech method, different methodology. All of that is very important from a student point of view.
Yeah, being very ambitious is one thing, and you want to complete within that time. I think that's very important, because after your PhD, you can do what you want. Because PhD is a time period, so you have to finish it, and the universities, as always, has the guideline what you need to do in year 1, year 2, year 3 until you do your thesis submission. So you are being bonded with that, but once you have completed your PhD, when you do a postdoc or you join a research institute or anything, you have a free rein. But that time you'll be dictated by your bosses, as well of your research grants, the timeline that you need to complete this. So it comes back to the cycle of governing things together. Okay, now any more questions? Okay, sorry.
Okay.
You can.
No, it's okay. I think I'll just speak up. This is for Ms. Ho. A couple of years ago, I was asked to use latent class analysis and then latent structural equation modeling for a research project that I was doing. It was so difficult, it hurt my head. How do you plan to use your research and make it more accessible to people who are not able to learn LCA and those type of advanced methods? How can they use it to help survivors?
Thank you for the question. I actually find that latent class analysis is quite difficult, but this is a methodology in introduced by my supervisor, and then we have a collaborator on board who had taught us using the Python to use how to do. I can share the code with you. The trick is we just need to know how to upload the data set into the system and then paste the code. When you run, then you find out that there are the multiple groups available. We get so in statistical, right, we get the sum of the assumption and also the framework. I can share with you later. It's not that difficult after I try to do it. And then in terms of the application, after we get this latent or hidden subgroup, we can associate with the supporting can. This is what I plan to do the next step. Using the structural equation modeling. I'm also still learning about that. It's doable. And also, how to say, like supportive care needs is one of Prof. Caryn's strong. For me, Prof. Caryn had helped to answer this question. The supportive care needs, like how do we actually combine the first part with the second part? Yeah.
Okay. So yeah, this is one of the reasons. This is a example of how we can work together as researchers. We all have different strengths. We all have different. Together we work together. We can come up with something that works, something that is useful for most people. And I think some of the suggestions in her lecture earlier, I think it's very useful to find a way to make it automated. Okay, so automated in the system so that when you plug the factors in, you inherently come up with a score that automatically stratifies the patient. And then from there, you have an idea as to whether what kind of support does this patient need. For example, you have very high scores in terms of psychological distress, then maybe you want to refer them to a psychiatrist or a psychologist. If it's just issues of adaptation, maybe you just want to refer them to a counselor. But then again, that is what in theory will be sound, will be the best thing to do. But we do realize that we can refer them, but they don't necessarily take you up on the services, and that's another challenge that we have on the ground. You want to add on that? Thank you.
Okay, thank you. So I think this explains why you need a collaborator also, to put things together and get things as what you go. Because at the time when you start, you may not say it, but as you go through your journey, like what she says and what Dr. Kavinesh also says, you will see things differently. That's the reason why it's 3 years to 4 years of work. So progressively, you see things change. Okay, any questions on maybe cancer survivor, caregivers, palliative care? Okay.
I love to ask questions. This one's for Dr. Mark. In relation to the issues, this is, I would rather say, is a controversial issue, manpower, which you mentioned in your lecture. You solve part of the service provision through the collaborations with the community, which is wonderful. But there is always an inherent problem of the healthcare provider fraternity. Just now we had a session on the other side at LT8, where MDT, multiple disciplinary team on provision of services for the cancer patients. And again, the issue is still manpower. So in your opinion, on the internal side, because you already mentioned on the community side, but the internal side, on the healthcare provider, how do you think that we could optimize the services when there is a lack of manpower?
I think there will always be a lack of manpower, and you will never be able to solve it. And I think that's why, as I've mentioned, the collaboration with community is so important. Not just to recruit community as mini health professionals per se, but also to understand what are the needs of a patient, for example, which might actually be better met through community rather than, let's say, through going to see a psychologist. So, for example, if a patient is lonely, right, we might think, well, that's one additional person to send to a counselor. Right? But it could be that, well, if the person had better company, better companionship that's enabled by the community, then you no longer, quote unquote, need that additional, or you reduce that demand further. So I think in order to optimize it, it really requires us to perhaps rethink and reframe how we see healthcare needs, and whether do 100% of healthcare needs automatically translate to what healthcare resources we need. We need to start thinking, perhaps some things, we move the thinking from clinical to more social and to more community-based. And I think that's where we begin to solve some of those problems. But certainly I think, as most people in the room are aware, we are increasingly also looking at more digital tools to allow people to be treated at home, to do more task shifting from let's say secondary or tertiary care to primary care. And at a higher level as well, it also requires government and policy makers to start thinking about their resourcing for health. Do you consider resourcing for health and increasing health workforce to merely be an expense, or do you view it as an investment in the country, in the population, that actually has its returns in terms of productivity elsewhere as well? So if we are able to change those thinking, if we are able to move away from thinking about health as just an expense, then this issue of, we can't afford more healthcare workers also starts to change in that sense. So I think there's a lot of reframing that needs to happen.
Thank you. So anyone else, any questions? Here.
Maybe I just ask my questions without. So my question is for Ms. Hoo. So I'm beyond from the National University, a PhD student. So I looked at your presentation. I saw that there is actually a big jump from class 2 to class 3, the numbers of patients. So I was just curious. Did you see any specific? I know you use 3 types of cancer for analysis. So did you notice if any specific type of cancers that are more susceptible to being class 3?
Yeah, I rephrase the question. So do I see whether that the class 3 is associated with which type? Right? We in the cohort that I examined, we see that there's a high association with breast cancer patients. Yeah. So this may change for a different cohort that we examine, because the latent class analysis is something very dynamic. For example, if we work in a clinic, we have 300 patients, so we just plug this in, then we see what actually compose of that community. So when maybe I do it in Malaysia, it will be different. I do it in Monash, it will be different. So in my cohort, to answer your question, is breast cancer. Yeah.
Thank you. Anyone else? Prof. Aaron?
No, I think I can speak
Can
loud.
speak loud.
I think what I felt through this presentation is the appreciation of the fact that it's just not about doing research for research's sake. Yeah? It's about doing research that informs policy, because that's very important. Yeah? We have to obviously accept the fact that, as you rightly pointed out, as a PhD student, you can't choose. You just do what you can do within the a specific context and specific time frame. But you still would be very useful already from the start to keep that in mind, that what you work on, especially if you consider this as public health, how that feeds into this. I also very much appreciated Mark's and others' comments about, community-based is not about the location. Yeah, it's about really engaging the people and working with them. So I think those are some very important takeaways for me as well, and hopefully for others.
Any questions? Okay.
Should I just speak out loud?
Thank you. First of all, I want to say thank you so much to all of you for wonderful, wonderful presentations. And also to you, Ms. Wu, congratulations on all the work that you've done. It's huge what you've done. I think only those of us who have done research and done PhDs know the incredible amount of work that has gone into the work that you've done. My question is to you, Prof. Caryn, and also to you, Dr. Mark. Sorry, my name is Beverly. I belong to the cancer survivorship research group at the Danish Cancer Institute, and we struggle to get funding for our psychosocial research and for research in palliative care, as I think a lot of us face that, especially if we would like to study under-prioritized groups, because it's the under-prioritized groups that are not prioritized by our care policies. Do you have any secrets or advice or insights that I can learn from and that I can bring back to my group on how we can better get funding for these under-prioritized topics?
Thank you, Beverly, for the question. I can only speak from experience, and I don't have that much experience, but what I do know is that generally the good news about doing research like this in cancer survivorship is that as opposed to lab-based research, we don't need nearly as much funding, but we still do need, a lot of work is very manpower intensive. You do need personnel, you need to think about the salaries of our personnel, your staff, your project managers. You know, you have to think long term. You're running a program, generally it's not just for 6 months or a year. You're thinking of ways to sustain the salaries for 2 years, 3 years, and the reality of it is that you're always perpetually looking for funding. So I think planning ahead is important, but also, as I said, looking into funding calls. Even on years you don't plan to apply, you need to be aware of the cycles, or the funding cycles. When is there a call? When do they generally make the announcement as to when the funding is going to come in? Alright, so certain is very predictable. So sometimes the key thing that you're studying at, you don't necessarily have to apply for research funding per se. You can also apply for educational grants. You can apply, you can work with, we talk a lot about public-private partnership in this Congress, and that's another way. You can work with also the industry sector, with people from outside of your, outside of academia, outside of the ministries in terms of funding. And increasingly what a lot of us are doing is that we are looking beyond Malaysia. See how you can align whatever you're doing with the priorities of organizations overseas. Do we share common ground? Is there a way you can shape, you can alter the angle of what you're doing to fit into what they're looking for? You have to understand, like, what are these funders looking for? Are they looking for big research publications alone? Are they looking to make cousins? You know, a lot of these international groups, they are looking to work with people from other parts of the world. And this is where you can come in. And generally, truth be told, you also need to show a track record. So you need to start small. You need to start from somewhere. You can't go from, when you first graduate from a PhD, you can't go from applying to a 10 million grant to 200 million grant. You start small. You start with a 20, show that you have a track record with a group of researchers, collaborators. You need to very clearly identify who is doing what in the research team. Okay? Start with maybe 20,000, 50,000 Malaysian ringgit, and once you build up a track record, it opens up the opportunities because you can show, this is the impact you've had in your programs. This is the research publications. You need to show that you can offer value. Okay, you are able to bring the projects to fruition, to completion, and that opens up other opportunities for you. People will give you a chance to do something more, something bigger. All right, perhaps Dr. Mark can add on this.
I agree with everything she said. The only thing I'll add probably is have rich friends. And I'm partially kidding, but I think from my own experience, a lot of my work has been funded through collaborators who have money. And so what that has required me to do in many cases is to actually reframe the topic of my interest into something that is interesting to them. So, and this is where if you consider health to be a social phenomenon, then this is where you are able to reframe it beyond just the medical and clinical aspects, so that it becomes more interesting to bodies outside of that coconut shell of medicine and healthcare. And we start reframing it as a way that helps society thrive. It starts being a way to help people become spiritually well or better. It starts becoming something that helps in the development of communities and nations. So now suddenly economic groups become more interested, business groups become more interested. So I think it's really seeing how best we can adapt and reframe our interests to align with the interests of rich friends, but really do try to make friends with rich people. They are really very loaded.
Or become friends with Mark.
I've spent it all, thank you.
Okay, thank you. So I think Prof. Caryn has mentioned one pointer. You can also tap on educational funds, but you need to realign your project towards educational. So I think Prof. Elliot has also mentioned about community-based. So it's a good opportunity. When you look at a lot of external grants, they like Malaysian population because diverse ethnic races and the community. So we have the suburb and sub-suburb. So all this plays a very important role. So you go from the urban to the suburb. I think Dr. Mark's research, I think you involve in your case you involve the community and also, so yours is also involved in the terminally ill patients, including with other diseases. Okay, so you find that the community helps a lot in terms of feedback, in terms of the caregivers and also the patient themselves. So you find there's a very kind of good interaction between all the three parts. So this funders definitely like this because I'm working on cancer, but on tissue, on patient base. So there's always a request on how do you interact all these things when you come and deal with next part. Okay, patient has already got a cancer. So how you survive with that and how the community supports that together with the immediate family members, because it depends on the culture. So based on our culture, you have to go out to the society. How the society going to perceive you? So I think these all are important part of research that can be, I think they all are doing some of those kind of research. So okay, that I think because time is coming to the end. So I think thank you very much for the distinguished speakers. And I think we'd like to give the token of appreciation to all these speakers.